I think so. All right, good evening and welcome. This is what parents need to know about today's weed and teen mental health. My name is Colleen Proster, and I'm the Executive Director of New Canaan Cares. We are an organization here in New Canaan whose mission is to advance the health and well-being of youth, parents, and all New Canaan community members. We do this by providing free programming and resources to the entire New Canaan community. New Canaan Cares is proud to be a part of the Mid-Fairfield Youth Cannabis Prevention Project. This is an 18-month project, and it's a collaboration between New Canaan, Norwalk, Weston, Westport, and Wilton. And it's led by Positive Directions, the Center for Prevention and Counseling in Westport, and funded by the Connecticut Department of Mental Health and Addiction Services, and supported by Catalyst CT, the hub. We're grateful for Demas's funding and for Francesca Guerriere and Margaret Watt of Positive Directions for their leadership with this project. The Mid-Fairfield project has allowed all of us to collaborate across our 5 communities and build capacity and relationships with our targeted sectors of prevention, schools, law enforcement, and our local governments, while also increasing awareness around the negative impacts of cannabis on our youth. Tonight is the third of a 5-part series of programs aimed at educating youth, parents, and community members about the impact of today's weed on a developing adolescent brain. Please find more information and the signups for the remaining programs on the Positive Directions website, positivedirections.org/events. For tonight's program, we'll have a 30 to 40-minute conversation moderated by our New Canaan Cares Education and Program Manager, Maureen Aziel, and she will be in conversation with our special guest speaker, Dr. Amy Swift, who is the Deputy Chief Medical Officer of Silver Hill Hospital here in New Canaan. Please put any questions that you have in the Q&A below, and we will answer them throughout the conversation and also leave time at the end for Q&A. Before we get started, I wanted to share a little bit about Maureen and Dr. Swift. Maureen is in her 4th year as the Education and Program Manager at New Canaan Cares. Maureen has a master's in public health and leads our New Canaan Coalition. She is a Narcan trainer, and over the past year and a half has trained dozens of New Canaan community members in how to use and administer this important life-saving medicine. Maureen is passionate about educating youth, parents, and community members on a plethora of topics to help us all live healthier, happier, and well-balanced lives. Dr. Amy Swift is the Deputy Chief Medical Officer, a specialist in addiction psychiatry, and oversees inpatient services at Silver Hill Hospital. Dr. Swift has nearly 2 decades of research and clinical experience and is deeply devoted to understanding and treating the most complex use disorder cases. Dr. Swift strongly believes in an integrative model of care where mental health and addiction are treated concurrently and comprehensively to address the root causes of an individual's needs. Her mission is to treat anyone who needs it, regardless of complexity. Before working at Silver Hill, Dr. Swift was the Medical Director of Addiction Services at Mount Sinai Beth Israel Hospital in Manhattan. In 2019, she received the Cynthia Zerinsky Research Mentorship Award, honoring her accomplishments as an esteemed educator. Dr. Swift has published and presented extensively in addiction psychiatry and other related fields. She attended medical school at New York Medical College and performed her residency and fellowship at Mount Sinai Beth Israel Hospital in addiction psychiatry. So thank you for all coming, and take it away, Maureen.
Great. Thank you, Colleen, and thank you, Amy, for being here. And thanks to everyone for all the flexibility. It's a crazy week for all of us with snow days and managing this. So we're so happy that we were able to move this to Zoom tonight. So Amy, my first question is really around messaging, and it's the messaging around the effects of cannabis on teens is highly confusing. What parents learned 30 years ago is no longer accurate. Cannabis in 1990 was 5% THC, which is the psychoactive ingredient, and today we see products on the market. If it's derived from a flower, it's up to 30% THC, or what's a concentrate product, it's upwards of 70%. So we're in a completely different world, and we're working from outdated information. But tonight, I know you're going to set the record straight. So, Amy, my first question is really simple. Given your expertise, what's the one message you really want families to know about today's cannabis?
So, if you remember one thing from this talk, it's that there is no role for cannabis in our teenagers' lives. Hard stop. This is a substance, like Maureen said, that we call pot, we call weed. We use these terms that we're familiar with, but they're not defining the same thing that our kids are being exposed to. And that's what I think is so important to understand is that we are using a term that is outdated for what these kids are having access to or potentially could have the impacts of.
Right, exactly. And that's why it's just so confusing. So, before we dive a little bit deeper into cannabis and then also mental health, can you help us understand what's happening with the teen brain, just physically and emotionally? And also, this stage of life for teenagers, are they more vulnerable to substance use disorder?
So I'll start with the first question. The teenage brain is developing, it's the most rapid period of development of the human lifespan. And it is developing literally every single day. But the thing that we have to understand is that it develops from back to front. And the front is the most highly developed, honestly, the most integrated, the kind of what we would call smartest part of the brain. The part that develops first in the teenage brain is the reward. It is the emotions. It's the part that is seeking the thrills. It's defining independence. It's being rewarded by having these experiences that are new. But the part that continues to develop in your early 20s and finishes developing by 26, that's the front part. That's decision making, that's planning, that's, impulse control. That is not developed by 18. That's not developed when they're in high school. And so much of their decision making is being driven by reward pathways and emotions. If we look at studies of which brain regions light up for teenagers, when you put anything with emotional content into the decision, the part that lights up is only the emotional part. Nothing in the front is lighting up. And so knowing that decisions are being made with emotions, we have to understand the implications of that for these kids. They're not trying to do things that are going to be dangerous or this or that. It's literally brain development. And for that reason, for the second question you asked, Maureen, they are at risk for substance use disorders. Substances hit the reward pathways. Most of them are hitting this neurotransmitter called dopamine that is the most important neurotransmitter in the reward pathway. And that's the only pathway that's really super active in the teen. So it really, really is a time that is an increased vulnerability for a substance use disorder.
Thank you. I think that's so important for people to really take that in because science has really gone so far in understanding what's happening in the teen brain. So, my next question is really around cannabis research. I know that there are three factors that are important. The potency, when you're looking at the different studies, the potency of THC, the frequency of use, and the age of onset. So, can you help the audience understand why these three factors are important and what the research is showing? Because there's tons of research happening inside and outside the US.
Right. So I'll start with the last part first.
Okay.
Unanimously, we know that the age of onset matters dramatically. So the longer that you can help a child or a teenager abstain from being exposed to cannabis, the more chance you have of it not disrupting any of the brain chemistry. So all of the studies support that people that start smoking cannabis or are exposed to it earlier around the 14, 15 age, there is much more of a dramatic impact than those that maybe start in the late teen years, 18, 19. The next one I'll answer is the first part, the potency. Also, there is unanimous agreement that the more potent, the more psychoactive is what we call it, the more chance you can have negative effects. And the negative effects we talk about with cannabis are primarily paranoia, which is when somebody is feeling very, very scared outside of the realm of what is normal or should be expected. And that's actually a definition of a psychotic symptom. So when we look at the really high potency cannabis or weed, THC, whatever you want to call it, we do know that there is a high correlation with psychotic symptoms, we'll say. And that's most usually paranoia. Another one could be what we call hallucinations, when you hear or see things that are not real. The middle part, the frequency of use, that's a trickier question. because we have so many different ways in which people are ingesting, smoking, vaping, however they are consuming their cannabis, it is a little bit trickier in how we quantify it. But what I can tell you is generally the literature has always showed that the more frequent exposures increase the risk of any negative outcomes from cannabis.
Okay, great. Can you set the record straight for us? Is cannabis addictive?
Cannabis is 110% addictive. It is a a substance where the withdrawal from it, so if you become dependent on it, the withdrawal from it is not medically dangerous. You will not die from withdrawal from it, but it will cause a group of symptoms that when you stop it are consistent, they are identifiable, and they're predictable. So for example, what I'll tell people is we'll get teens that come in for hospitalization for other reasons, for depression, anxiety. And about a week into when they're there, they'll talk to us about how they have these really vivid dreams. And I'm like, oh, you smoked pot a lot. And they're like, how'd you know? And I'll tell them because this is what cannabis withdrawal is these really, really vivid dreams. I said, let me ask you a couple other questions. I'll say, are you not as hungry? Do you have, kind of trouble eating? They're like, yeah. And then I'll say, are you finding that like you're snapping at people a little bit more, you're a little bit more irritable? And they'll, kind of look at me like, what is this lady doing? How does she know these things? Because it's cannabis withdrawal. They were addicted to the substance physiologically and psychologically. And so it's a predictable syndrome. And so yes, it 100% is addictive.
So we learned as kids that, in health class, we learned that it wasn't addictive. So that's where like that is just like such an important thing for adults to understand that, it's just another way to think about it that because people don't necessarily think that it is addictive based on what they learned so long ago.
Well, I can make another analogy for you. You know what else is addictive is coffee. Many of us drink coffee. We know the morning you don't have coffee, you can feel it. The difference is that coffee doesn't make us psychotic. So we don't care that coffee is addictive. It's not as hard to quit because it doesn't hit the same receptor profiles. But just like how coffee it's natural, it comes from a bean, cannabis comes from a plant, both of them are addictive. It's one of the myths is that because it comes from something natural that it couldn't be bad for our bodies.
That's great. Yeah, no, that's a great way to think about it. Another question is, can you overdose from cannabis as well? That's
A
something that
hun-
keeps coming up.
100%. But we call it something nicer. When you overdose from alcohol, we call it blacking out. When you overdose from cannabis, we call it greening out because greening sounds nicer. But you can absolutely set yourself into a state where seeking emergency services would be recommended, meaning that people smoke so much that they become so paranoid, so anxious that they are panicked and they cannot honestly get their bearings straight about where they are, how to interact with people. It just disrupts their ability to communicate in such a detrimental way. So absolutely, you could smoke too much that you would need to seek emergency services, which is what I would classify as an overdose.
Right. And I know that, I have three kids of my own. I've definitely heard the term greening out, but I didn't, when I first heard it, I really didn't understand it. And I think it was listening to you speak that you brought up greening out. So I was like, oh, that's what, like, so there's just terms that kids are using that, it's good for parents to know what it actually means. Um,
They make it sound euphoric. They make it sound kind of desirable, like this is going to be some pleasant experience, like you're floating in a cloud and that you get to be distracted from all the worries of life, but that's not the reality of what it is. It really is a hyper aware state where you feel unsafe.
right. So, in terms of now that we understand some of the studies and a little bit more about cannabis, just because we have you and you're, living this and you have real world examples, and I think everyone's curious about, what you're seeing in your patient population, things that you might be able to share. And also, I'm curious about the fact that have you noticed a difference between your patient population before cannabis was legal till like now where it is legal? So, just if you can.
Okay, there are two comments I have on this, and I'll actually start with the second one. The bigger problem I have with cannabis being legal now is with the parents, honestly. It's that the parents are permissive of cannabis for their adolescents, and they don't realize the difference between what cannabis does to them and what we as a nation are saying cannabis is okay for. Cannabis has, in Connecticut, I think the legal age is 21. That's completely arbitrary. It's not based on science. It's not based on brain development. So it doesn't mean that the day you turn 21 that your body is okay with it and a month before it isn't. And so now when we have kids that come in and have mental health concerns that really have been either contributed to by cannabis use or escalated by, it is a factor we need to consider. It's very hard for me to talk to the parents about why I'm recommending that they don't allow their kid to smoke pot or have gummies or whatever they've been allowing, because the parents are saying, but it's legal. How could you tell me that this is bad? And so I think that it has to start kind of from the top down. And then the other thing that I'll say, kind of in practice, and this is something that just was relevant in the literature this week, a study came out this week that talked about the impact of cannabis on mental health. And what it showed, there were kind of four salient points from it, and I'll distill them down for you. One is that teens that smoked cannabis were 2 times as likely to be diagnosed with a psychotic disorder later in life, which is not surprising given that we know that it's what we call, again, a psychoactive substance, meaning that it hits receptors that can cause hallucinations or paranoia. Two, it increased the chances of someone being diagnosed with depression by about 32%, anxiety by about 24%. And then the biggest one, and this is what kind of is something that I see in my practice, is that this isn't contemporaneous, meaning they smoke pot and they get depressed or they get anxious or they get diagnosed with a psychotic disorder. There's this lull. So they'll start smoking pot, and then a year, 2 years later, these mental health concerns will really crop up. And it's very hard for them and for parents to see the connection. And so I think that's where we as a society have to do a better job identifying the risk that this seemingly innocuous substance that, our country is saying is legal can really introduce a mental health diagnosis that can inhibit functioning, and can be really tough for a teen to navigate. Like I said, their brains are driven by emotion. And if their emotions are in a dark place, that's a hard place to live.
Right. So moving on, I'm going to get deeper into mental health now, so that you can, elaborate on. In terms of teens, they have pressure-filled lives. They're balancing academics, sports, and friends. And we know that there are tons of protective factors for kids. And you can, tell us even more. There's healthy coping skills, there's developing agency and independence, and having supportive relationships where they feel valued. Can you talk about the connection between mental health, coping skills, and substance use, how they're connected?
So one of the things that I think that we could do the best for our kids is by teaching them the skills to build resilience. They don't have the brain development yet to have the impulse control to delay gratification in a really meaningful and consistent way. So we have to just kind of artificially teach them the skills that will then support when the brain development gets there. Meaning, it's very hard to say no in a sea of yeses, right? No kid ever wants to be the one that doesn't accept this, right? It's not that they maybe even are curious about pot. They just don't want to say no. They don't want to be left out. They don't want to be identified as being weird. So building their skills in how they can manage the emotions related with that is really important. So one of the things that I think is really important for teens is to reframe the no. It's powerful. It is the thing that nobody could take away your no, and your ability to say no is something that may be the strongest thing that you have. And so allowing them a place to practice saying no so it's readily available is really, really important, because in the moment, in these high pressure situations that have emotional attachment, reaching for that no might be a little hard.
Right.
So we really have to teach kids how to, and then coping with that initial wave of embarrassment that comes the second that you try to do something. I think all of us have had the experience of their kid coming to them and say, mommy, I tried to do this and this and this, and this happened instead, and the disappointment of it. And teaching the kid to sit through that disappointment, right? Emotions only last 90 seconds, but what you do with that time period is the impact of what it has on you. And so teaching them to ride the wave of the disappointment, the embarrassment, whatever it is, and then being clear to see what actually happened. So when you didn't take that joint that they passed to you and you said no thanks, and it went to the next person, and maybe one person laughed at you, somebody made fun of you, and then 2 minutes later, did anybody care? But sometimes we have to highlight that for them because they can't see it without our cueing.
Right. And that's something to be said for, practicing no before these kinds of situations come up. When kids are younger and having different situations for them to feel comfortable with all that. So when they get to the point of, these bigger questions and things that they're offered, that they feel confident in themselves, and that, speaks to, developing agency. Is that something that you want to elaborate a little bit more on?
Yeah, so independence is the thing that our kids value the most, right? It's peers and independence. They want to be independent from us and they want to be like their people that are their age. And the thing that we have to teach them is how to use it in a way where they are collaborating on both of those, meaning that they're independent from the peer influence. And that is something that is very hard for them to see in the moment. But we as the kind of responsible adults in the room, the more that we can show them how they get more and more independent. So, oh, because you called me when you were with this friend that you didn't really feel comfortable with and you let me know, like, I'm thinking maybe we can, consider 30 minutes more of a curfew, like highlighting for them and shaping their behavior such that when they do things that are really good for independence, good for autonomy, that we call it out and we reinforce it. Because if we don't do it, it was almost like it was a pebble in a pond. It doesn't make a big enough ripple to make an impact.
Right. So moving to just cannabis in general, it's legal for adults over 21 in Connecticut, which is similar to alcohol. And that might send the message to kids that it's harmless, as you've talked about before. But so many people are familiar with alcohol's effects on the body, both short term and long term. I was wondering if you can compare and contrast the difference between alcohol and cannabis, even talking about the risks, the physical and mental health effects, things like that. You've talked about it a lot already, but maybe for people to understand that just because they're familiar with alcohol.
Yeah, for sure. So alcohol is something that has it's a lot more visible. It smells, right? It has intoxication that many of us can really identify. The person stumbles, the person looks a particular kind of way with we call it a ataxic, meaning their uncoordinated gait. It's a very obvious intoxication. Cannabis is a lot more invisible, right? Like you could have a gummy and there's no smell. It is something that once you have ingested it and, kind of it's been absorbed, it really could not be obvious to the naked eye. But that actually becomes more problematic because when somebody is intoxicated, you don't realize that their behavior is being impacted by it. So for example, there are a couple of things that cannabis does in acute intoxication. Number one, it makes you really slow to react. So people think that it's totally fine, but driving on cannabis is still considered driving under the influence. Your reaction time is so slow that it is not safe to drive with cannabis in your system. They noticed it in Colorado when they first started legalizing it. The amount of auto accidents went up just because reaction time alone is problematic. The other thing, which is really impactful for kids, is that they can't read the emotions of people around them. And so all kids want to do is connect with their peers. And if they have taken something that in their brain is just chemically inhibiting their ability to read the reactions of others, it's going to be harder to connect and they're not going to feel as rewarding in these experiences. The third thing that I think is one of the most problematic is it makes people paranoid. It really does make some people quite paranoid. And kids, they may think it's funny. They may be looking at that kid that's hiding in the corner because they smoked too much or they ate too many gummies and it's, the kind of the joke of the party. But that kid is suffering and that kid is now interpreting this whole experience as traumatizing probably. But it was just this legal thing that they did. So they write it off as not being a big deal. Well, guess what? That kid that was really paranoid in the corner could end up, if they continue to use it in a constant way, they could end up really changing the chemistry of their brain such that that's something that's right under the surface and comes out anytime they're exposed to it. And that's a problem. We don't see that with alcohol. Alcohol is the intoxication period comes off and that's it. And whatever is done during that can be really destructive. Don't get me wrong. People make very poor decisions on alcohol. It definitely impairs decision making and also reaction time and people become disinhibited, all those things. But it doesn't start to take layers off of the protective factors of the brain the way that cannabis does.
Right. And I mean, where we're living right now, or the time we're living in, the post-COVID time, and everything is about connection right now, that, with the effects of cannabis and what you were talking about, I mean, that is something alone, the isolation and, things that people are feeling, that's, something that maybe for kids might be a reason why they wouldn't want to do it, because that's where the isolation is, not good for them to connect as well, and for parents as well to think that it is a big deal, because those are the behaviors that kids are experiencing with that as well. So another piece of it is really the long-term effects. So I know that, cannabis, if you can sort of talk about that, because there's a lot to unpack there.
So cannabis, it comes back to one of the questions you asked earlier. The long-term effects of cannabis depends on the type you're using, how potent it is, how much you're using it, and honestly, your genetic makeup. That you can't control. So that one will, kind of level the playing field. If you know you have a family member that has a history of bipolar disorder, schizophrenia, schizoaffective disorder, honestly, even maybe severe anxiety, depression, be aware that cannabis may affect you really negatively. But the other things are really dependent on what the long-term effects of cannabis are. So let's say, for example, you get a kid that becomes psychotic on cannabis, 16-year-old kid, and mom comes to me and says, is this permanent? Is my kid going to be like this forever? I would say to her, I would say, listen, I don't have a crystal ball. I don't know. But what I can tell you is if he never smokes pot again and he potentially takes medication to quiet whatever happened now and keep those psychotic symptoms at bay, this could just be a story he tells in 5 years, in 10 years, about that time that he realized he had to make a change in his life. And he did. And he essentially saved his brain. The adolescent time, even though it is changing so much, and I talked about how risky and vulnerable it can be, it's also protective in that it's changing a lot. And so if there is an insult and we get this red flag, if we listen to it and we react appropriately, we have the ability to rebuild. So it's something that I really would tell somebody in that moment, do the best you can to succeed, and let's make this the opportunity to say, hey, I listened and I significantly lessened the impact and the long-term effects of this.
Right. One thing that I think, just in general, the public might not understand is psychosis. Can you, because you're talking about psychosis, and just can you explain what psychosis is or define it for people just so?
So the layman's term, the way I would say psychosis to somebody that isn't in the mental health field is it either is paranoia, which is a term we really understand, but that is defined as a thought or worry of a threat that isn't identified as real, an overvalued perceived threat. And so that's something that is very, very common with cannabis. But then the other psychotic symptoms, there are a couple of other ones. It could be auditory hallucinations, so hearing voices that are not present, visual hallucinations, which we don't typically see with cannabis, or psychotic disorders. Those typically come out with hallucinogens. So when people are using things that Molly, things like that, mushrooms, stuff like that. And then the other thing with psychosis could be these ideas. There's a chip in my brain. There's people watching me. It's things where they have a idea that is just, there's no founding for it. And we have the two categories, bizarre and non-bizarre. So you could have one that the people watching me, I can't prove that no one's watching you, but the chip in the brain, I know that that's likely not real. And then the last part of psychosis is when people are disorganized, when they can't really communicate appropriately. And that's the hardest one, because I think it's really hard for parents to see it, because we all fill in the gaps of what our kids are saying. We know our kids so well that when they start to say something, we can kind of put it together. But what I always say, and what I always used to say in training when I was training physicians, I would say, if you can't follow them, it's them, not you. Because if we aren't psychotic, we know how to follow a train of thought. But if somebody is really not able to describe what's happening, then there may be some disruption there. And that's the hardest one for parents to see of kids that, smoke pot and get really psychotic.
Yeah, no, that's probably very upsetting. I don't think you did mention this before. Did you talk about bipolar as well? Was that something?
No, not yet, but bipolar is really interesting. Early in my career, I had this kid come in. He just turned like 18, like 2 days before he came in. I was working on an adult unit, and he came in really, really depressed, and like densely depressed. And we treated him and he got better. And I saw him a year and a half later and he was floridly what we call manic, which is when they are in this elevated mood. They barely sleep. They can have psychotic symptoms. And it was really interesting because I do think cannabis contributed to the way we saw him present. But when we just saw him for the depression, it was like, you know, you felt for this kid. Like he seemed like he was just going through a really rough patch in life. And you really wanted to get him back to, you just didn't put all the guardrails in because it didn't seem as serious. With bipolar disorder, it's more serious because the manic states are really dangerous. Depressive states are dangerous because of suicidality and things of that nature. But mania, they can have what we talked about, this disconnect with reality, and they feel invincible. And they have what we call grandiosity, which is where they think they're amazing and they have all this power. And that is something that oftentimes, if somebody has an underlying bipolar disorder, cannabis will bring out that state. And that's what's really dangerous. And so it's not that the cannabis caused it, it's that it exacerbated that or brought it out of the timeline that we saw. So it's really, really important for people with bipolar in the family or a diagnosis themselves to abstain from cannabis.
Right. And is that the same for schizophrenia as well, or?
It is. Schizophrenia is a little bit tougher because sometimes people, even when they on medication, they still relapse into a psychotic episode. Taking medication for a schizophrenic patient doesn't mean that they'll never have psychotic symptoms again. For bipolar disorder, if you take medication, you could pretty much prevent any significant mood episodes. You might have ups and downs, but you won't have really like hospitalizable episodes. With schizophrenia, sometimes you do have psychotic symptoms, but schizophrenia and pot are oil and water. There is nothing good for a patient that has a diagnosis of schizophrenia with pot. Honestly, it just makes it much harder to treat their symptoms. It makes it much harder to shorten the episode, and it increases the chances that another episode will happen quicker.
Right. And would you say that these could become permanent? Is that something that
So it depends, right? Like if you continue to use, it could be permanent. If you stop use, you are giving yourself the best chance that it's not permanent. If there's a strong family history, the chances that it is permanent are higher. But if there's no family history and they, like I said, stop smoking pot, take meds, you could consider the opportunity that maybe this is something that lives in the background and we know, but doesn't become part of their everyday life.
right? And just shifting gears, maybe backing up a little bit to something a little bit lighter, I guess, but not quite. Um, is there a drop in IQ when it comes to smoking or using cannabis? Is that
So
something?
it's not, most of us don't have like IQ point tests, right? Like we don't, like
Right.
I don't know my IQ, right? But what it does inhibit is executive functioning and learning and memory. And so functionally, it could impair your ability to intellectually perform because of its disruption of memory and executive functioning.
Okay. So question for you in terms of I was actually talking to my son earlier tonight, and just he was saying that, a lot of people think that it's just a plant and it's no big deal. And, when kids are having conversations with their friends, my son actually knows a lot about, what you're talking about tonight. And he's not even listening because he's like, what else am I going to learn, Mom? I know a lot. So, but, it's when kids are talking to their friends and their friends don't necessarily understand the impact that cannabis might have on them, it can be, upsetting. So what would you say to, a child or a teenager, like, to help them in that conversation with their friends that they care about?
I would say amplify the positives in their own choices. We've talked about this. Nobody likes being told what to do, particularly teenagers. And so they don't even want to be told what to do by their peers. So you saying, Billy saying to Joe, oh, you shouldn't do that, it's bad, isn't going to have an impact. But Billy saying to Joe, oh, I choose not to do it because it's something that kind of controls my brain a little bit, and I want to be in control of my brain. I don't want anything else being able to impact me. That carries less of an emotional value of kind of the insult to autonomy. That's somebody giving their opinion that has fact, but it's a less intrusive and a less confrontational way to say it. So I always, I think our kids these days really always kind of get into these peer, oh, you shouldn't do that. This is good. You should do right. And I think that the more that our kids can feel confident talking about their choices and offering supporting evidence for their choices, but being specific to them is a way for them to feel like they're still imparting knowledge to a peer, a loved one, a friend, whatever it is, without feeling that confrontation, the discomfort of confrontation.
Okay, thank you for that. And then something else that I've heard you talk about before, but I just want to highlight because I think it's important for people to know, and it does play into what you've already talked about. But it's, if someone has a bad reaction to using cannabis, you've talked about it being a warning sign. Can you talk about that a little bit?
It's something that we should never ignore. If you eat a bowl of ice cream and you are running to the bathroom vomiting, should you go back and eat ice cream again, right? If you smoke pot, if you take a gummy and you feel terrible, you're confused, you're scared, you don't know, your heart's racing, you thought that Joey was talking about you and he wasn't, or you get the feedback the next day that everyone's like, oh, wow, did you see Sally last night? If you have any of those things, pay attention. You don't need these things, right? And the idea is to be able to see that as an opportunity to take the data and make a change. It's where I would love to inspire parents to just casually, curiously have the conversation and open the floor to say, hey, have you ever been around when somebody looked really odd after they smoked pot or took a gummy? Like, what was that like? So that the kid can understand that that's not normal. And if that's happening, we have to listen. It isn't something that you can identify just by looking at somebody, how they're going to react. You have to pay attention when you get the data and not discard it.
Right. And something else that, I've heard, and it's something we used to say a lot when we were younger, and that's why it triggers, when something serious happens and cannabis is involved, people often say, oh, it must be laced. What are your thoughts on that?
It's not laced. It's the cannabis. It's the cannabis. It's not laced, I promise you. If somebody smokes, a joint and then literally falls unconscious and has to have CPR, sure. Maybe there was some respiratory depressant in there. Fine, I'll give you that. But if somebody has a bad reaction, I promise you it's the cannabis. It's the cannabis that is out there these days is so potent. It is not meant for the brain. It really isn't. And so it is 100% the cannabis. That can be my other tagline is besides
Yeah,
there is no role for for pot in your teens' lives, it's that it is the cannabis, it's not laced.
right. But this is, Cannabis 101. These are things that we all should know because it's almost a new product, and we are thinking about it from 1990. We're at 7:39. I have a couple more questions, and then we can open it up or actually, Colleen, are there any questions on the chat that we should?
There are three if you guys want to respond to these now. The first one was, does the state of Connecticut have any data on ER admissions for cannabis-induced psychosis rates since legalization?
I
Knowing the
don't
majority of these are teens and young adults, a data timeline would be amazing to show the direct relationship.
I don't know if they do, and I don't know if they're going to, because there's an industry attached to this. So I don't know if there is going to be a drive to pull data that has financial implications for an actual, an industry. That being said, there definitely will be data in the next 10. I also think we're too close to it to see it. We all know it's happening. We all know there's an uptick. Everybody in the field knows it. But to show a true trend, you really have to get 5 to 10 years of data. And COVID kind of messed us up a little bit with impacts of other contributing factors. But it will be something that hopefully we can concretely show. Um, I don't know if it'll change the industry, but it absolutely is happening.
Right. Okay, the next question. If psychotic processes or hypomanic behaviors can manifest in adolescence upon heavy cannabis use, how is that being accounted for in the acute and later phases of care in order to avoid an unnecessary treatment course?
So this comes up a lot. What I tell parents is that even if it was brought out by cannabis, I can't let the brain be on fire in the way it is because a psychotic process or hypomanic behaviors are indicative of a neurotransmitter disconnect that shouldn't be happening in the brain and disrupts other things. So even if it was brought out by cannabis or, how whatever incited the lasting effect, I have to treat that. So regardless, the treatment's the same. Um, you never want, I actually said this to one of our, we have these people at the hospital called, there are patient navigators, and they talk to the patients and kind of manage the patient experience. And I was explaining it to one of them today. It's like, even smoking pot sometimes is like taking little matches and throwing them all over a forest. And if you put enough of them there, a fire starts. And it doesn't matter why the fire started or how the fire started. I still have to put the fire out, or it's going to burn everything around it. So it doesn't matter if it started with those tiny matches. I have to put it out with the meds. I can't let it burn.
Yeah. Going back to the first question, Margaret Watt said that our local health departments can pull the information regarding the ERs. In Norwalk, the health department has provided analysis for Norwalk Partnership showing an annual increase.
Yeah,
So,
it's definitely there. I just don't know if people are going to write about tying it to legalization, but
right.
it's there. For sure, it's there.
Okay. Do you feel like the lack of DARE program that some districts benefited from back in the day is something that should be re-implemented in all school systems with the high use of cannabis now and other drugs?
I think honestly, it would be more impactful to do programs that tied parents and kids together, because telling kids not to do something if the parents are modeling maladaptive behavior doesn't help. So, if one of the things that I know that Maureen and Colleen and I have talked about is that just like the kids, the parents don't want to be told what to do either. But we have to be our most conservative selves in front of our kids. And if our kids see us smoking pot, taking gummies, all these things, it doesn't matter if they're sitting in a million DARE programs, they're still going to say, but mom does it, so it's okay for me too. So I think that a more kind of innovative approach would be a collaborative approach with parents and kids together, so that we make sure that we're addressing everybody that could have an impact on this behavior.
Right. Okay, thank you. The last one, someone said, what impact do these substances have on reproductive organs and future sexual health?
So less so with females, more so with men. You smoke a lot of pot and it definitely lowers your sperm count. And it's again, not you can't directly correlate what the impact will be, but if you're looking for somebody that wants to be at your optimal sexual health, don't smoke pot.
Right. Okay, so I have a couple more questions, and then, if there's any more that come in, it'll give people a chance.
Let people know that everything is anonymous. So if anything that they want to type in, feel free. We're not,
Yeah,
everything.
exactly. So we know from history that industries like big tobacco have marketed to young people to become lifelong customers. We saw it with Juul. There was a lawsuit. We're now seeing it with Zyn, which is a new nicotine product, and there's a lot of social media out there to try Zyn and knock off cannabis products that are, they're marketed as candy. So those are the illegal cannabis products. But we also know that kids are smart and they don't want to be manipulated. So how can teens use their own intelligence and decision making to make healthy choices? And why is this approach better for their mental health than just being told what to do?
One of the things that I think is really impactful, teens are, you're right, they absorb everything around them. And the density with which things are around them makes it seem familiar. Decrease the stigma of it, decrease the kind of, what we want to think it's shrouded in mystery. So maybe they won't try it because it seems so ubiquitous. It's like, why not? I think the thing that we could do the best is that provide the counter argument, right? Just as much as everybody's marketing all these amazing things about it, is that we as a culture have to be better about allowing for there to be the ambient noise about the reality of it, which is that it impacts kids' ability to be independent, to be autonomous, to be optimal in their intelligence, in their connectedness, in their, it's something that it has to be a measured response, because your marketing's creative, but we could creatively market in the other direction too. But somebody's got to take the initiative to do it.
Right, exactly. Well, this really plays into having these difficult conversations. So, as Colleen mentioned at the beginning, I am a Narcan trainer, but half my Narcan training is really about having conversations with kids about substances. And Narcan, it's fentanyl, which is incredibly scary for people. But, I'm not making a plug here, but I do think for parents to like take a Narcan training just to have the understanding so that they can have a good conversation with their kids, why to avoid it. There are fake pills out there. So in terms of, cannabis and for you, what would you say to parents? Like, when's the right time to have these conversations? What has been very effective, in the work you do?
I mean, I always tell them, number one, I usually invite them in so I can model the conversation with the kid in front of the mom. And invariably after the mom will pull me aside and be like, "Can you help me? Like, I don't know how to do that." And I'm like, "Of course you don't know how to do that. It's emotionally charged. Like for me, I can have this conversation with your kid because there isn't this push-pull dynamic of mom and child, right?" But so I would say number one, if there is a real concern, enlist a third person to help you because it's really, really hard for us to have these conversations with our own kids when emotions get involved. But that leads me to my second point is start practicing it when emotions are low. Like don't come at a kid when they come home from a party, they look a little bit off, like, oh, were you smoking pot? Were other people smoking? That's not going to get you the value. Wait till you're sometime kind of low stress and sitting around and say, hey, like, when I was younger, like kids used to smoke pot all the time, or I was around, people that were drinking. Like, what do you do when that's like it? Don't ask if it happens. Ask open-ended questions to inspire a conversation to start. Because if you say, have you ever seen anyone smoke pot? I know what they're going to tell you. They're going to say no. They probably did earlier that day, but they're still going to say no because they want to shut down the conversation. So the more that you make it an opportunity for a curious back and forth, allows for you to find the ambivalence within the child. But then if you really identify a concern, I would tell parents, don't try and do it yourself. Like bring in somebody to help you. We have so many resources in our communities of people that are willing to help. Just reach out. It's not worth not, honestly.
Right. No, that's incredibly important, especially when kids are older. But even when, kids are younger, it's just having, obviously not conversations about cannabis, but you can start laying the groundwork for these conversations as kids grow up over the dinner table. Early and often is always,
Right.
a phrase we use in our world. So, and it could be simple, you know.
Right. And it's allowing them to ask. So, like, kids will ask us questions, right? Like, my kids will ask me, they're like, wait, but you, like, if we say somebody was drunk or something, they're like, wait, but you drink alcohol. And I take the moment to, like, really explain, like, what the difference is between moderation or, like drinking and not driving or drinking. There are all these scenarios that we as adults think are so obvious, but to the kids, you really have to spell it out. So for somebody saying, even as importantly to, if a 10-year-old asks you about what about smoking pot, say, oh, that's something that's really bad for your brain, at your age. That's something that's really bad for your brain as a teenager. Just leave it in these simple little informational nuggets that you're planting so that hopefully somewhere down the line, when they get exposed to it, they can pull, it just mom's voice is just kind of in the background saying like, oh, it's just about planting the seed. The water, the light, the food will be there, but you want the seed, you want the flower to be able to grow. And if you never plant the seed, it's never going to grow.
Right, exactly. So I do want to end on some good news is, the local youth surveys are roughly saying 75 to 80% of kids are not using substances. We see that in Westport and Darien, so there are local surveys happening. So that's a large majority, and we want to keep it that way. What should you do when someone's struggling, and what are resources available in the community?
So that the thing is, because you highlighted how many people aren't doing it, if someone's doing it, pay attention. They're outside the norm. And there are studies that show that if you give services to the most at-risk youth, it's called herd immunity. It trickles down to the people that were kind of on that cusp. So there's going to be a group of people that weren't going to use it at all. And there's a group of people that has a real concern and potentially use disorder. And then those are people in the middle. If you treat the people with the use disorder, you're going to actually help the people in the middle too. So it's really, really, really important to identify those people that have the problem per se, and treat them. But there are so many, resources, and I actually kind of have a list of some of them. But honestly, any adult doesn't have to be parents. Like most people won't go to their parents, but they may go to one of their parents' friends, a cool aunt, something, of that. There's always a pediatrician, counselors. We at Silver Hill, for a couple of the towns that you guys are associated with, we have something called the assessment program, where if you call that, the town subsidizes it such that it's for Weston, I think it's Weston, New Canaan, and what is it?
Westport.
Westport. That's what I thought. I knew it was one of the W's. They can come in and get an assessment within 48 hours, sit with a doc. Sometimes if it's an addiction case, it's me, and a social worker. And we go through and we meet with the patient and we talk about them and with them what the concerns are, and we connect them to care. Within, the next week, we get them a psychiatrist and a therapist or whatever else they may need. There's also a kids in crisis hotline. There's information at Catalyst, the hub. We could put, some of the websites in the links. If a kid takes something and they panic, they get really paranoid, they smoked pot, they ate a gummy and they're really worried. Honestly, they could even call poison control and they'll get some connection to somewhere. There's things that you could do. But you could also call 211, 988. They're just resources to reach out. There really are a multitude of things, but you want to have those things within reach so that you don't look for them in the crisis. You just want to know where to find the information.
I think we can send out all of those resources when we send out the recording. And throughout the 5 communities, we have 5 local prevention councils, and we'll share, this recording and those resources with our communities. So there are 4 more questions here, ladies, I'd like to get to if we can.
Yep.
So let's see. Oh, there's a few more coming in. Could you explain in greater detail the numerical THC levels, how this cannabis is so potent versus what in prior generations that we saw?
So they've been distilling it down so that they can make it so that smaller quantities get people farther, and it is more undetectable. We are a culture of more for less, right? Like it's kind of how we live our lives. And so, I mean, I've never actually been in a dispensary, but my understanding is that in dispensaries, they talk about the different levels of THC versus CBD. And many of them in the dispensaries are over 20%. The pot people were smoking, of our generation was like 5%. So this 20%, even, the one that they're selling in the dispensary, all that is going to hit the receptors in a problematic way. So it really is. And that's just the ones that we know of. These aren't ones that people are just, cooking, creating in their backyards.
Somebody asked a question around 70 to 80% of adolescents are not using substances. Is that all substances or cannabis?
I'm pretty sure that that's probably all substances because this generation's not drinking much either.
Right.
It's,
Right.
yeah.
No, it's definitely. I mean, I can speak for Westport. I know that it was for drinking, it was actually the highest, 27%. But I think the way that you should think about it is like if you take high school, it goes up,
Like
so by
exponentially.
12th grade,
Yeah.
there's more kids doing more substances than there are in the younger grades as well. Cannabis is very low. So obviously alcohol is like in the 20% range. Cannabis is, I don't have the numbers in front of me, so I probably should have, but it is very low. And some of the other substances are not, they weren't asked in the surveys, but we're not
That's
seeing that
important
as well.
data when you're having the conversation with your child to say, because our kids are always saying, everyone's doing it. It's like,
Like,
you
well,
know,
actually.
yeah, the statistics are important for them. So,
Right. And I think also as we move towards a trend of less alcohol, I worry about the idea that this will start to really replace it. Like we shouldn't rest on our laurels and think, okay, they're not doing anything. They're being, entirely sober. It's like California sober, where they're not drinking alcohol, but they're smoking pot all day long. That's not
Right.
what we want. We want to make sure that we prevent that from happening.
Right. So
I
nationally, well, I was just going to say, so nationally, alcohol rates and tobacco rates, you're seeing they've been going down since the 1990s. It's at the lowest rate that it's been. But I would argue, and anecdotally, it seems like, with these new nicotine products that are very easy to hide, you're going to see tobacco products sort of go back up again because those nicotine products are very strong, so kids are getting addicted very quickly. And cannabis obviously is, going up as well.
Right.
All right, the next question I have is how would you set boundaries for college kids that are returning home for the summer and have chosen to smoke pot, use gummies, etc. at school?
I think that it's really important to tie it to independence, that there are things that kids do on college campuses because college campuses, in and of themselves, oftentimes are safety bubbles, right? Freshmen may not have a car. There are other things. When they come home, they're going back to a community setting where they have what can be impactful experiences for intoxication. So they probably will be working, I'm sure want to drive, things of that nature, and saying to the kid, listen, I understand that at school, there are different circumstances. In my house, with the independence that I am happy to afford you, there will be some rules that will need to be abided by. And there have to be natural consequences. If somebody comes home intoxicated after driving a car, you have to take away the car. Because if you don't enact the natural consequence, then there's going to be a back and forth all summer of trying to figure out when this is actually going to be enforced. And that's the hardest thing, I think, for parents is sticking with the consequence of disappointing the kid.
Right. Someone just talked about how their child is vaping cannabis and they've
Mhm.
tried to take it away, but the child always finds a way to get another one. How can I get my child to stop?
I mean, they need to get into care at this point. Like you've tried to remove it, they are addicted. They're seeking to get it in a way that is a brain-driven desire, as opposed to just oppositionality. They're not doing it just because mom said not to. They're doing it because their brain's telling them they need it, they want it, they enjoy it. So they just should get some counseling, about what it is about it that is so desirable. Break the cycle, teach them some skills and how to ride the wave of the withdrawal from it and get through it.
That's great advice. How is social media impacting lower levels of using, do we think, cannabis?
I mean, the social media impact it's huge and almost immeasurable, right? Because like we don't know what each person's digesting. We know what's out there in social media, but we have no idea how people are consuming it. Um, I think that the social media presence of the decrease in drinking definitely contributed. I think that a bunch of, kind of Gen Zers stopped drinking because people said Gen Zers are stopping drinking. So the Gen Zers are like, okay, I guess we're stopping drinking, right? Um, I don't know what I don't know if Maureen, you have any thoughts about this, but I don't know what the social media direct impact on cannabis use is.
Yeah, I mean, I think it's available and out there, and I think kids are talking about it. And, I'm hearing words like I'm going gardening is something that kids have used in relation to using cannabis. But it's really, I mean, it just comes back to talk to your kids directly about this. They're going to consume what they're going to consume, and we can't stop them watching the social media because their lives are on social media. I mean, I hear so much about being addicted to social media. I mean, I think everyone after this talk, me included, is like, you should really be worried about being addicted to cannabis. I mean, social media is, bad for all those things, but it's not going to go away. You can actually not do cannabis, and like, so that's sort of my thoughts on it.
All right, it's 8 o'clock. I've got one more question here. What recommendations do you have for adolescents who don't believe the statistics that most people their age are not using?
I think, unfortunately, for adolescents, they don't believe statistics. They don't care that people aren't using. We
Right.
have to, like I said, point out instances in when we see that people aren't using. We have to craft situations for them or highlight situations for them that they get what they want without using. So if they want to fit in a crowd, they want to talk to others, they want to have positive experiences, watch until they do and then say, hey, listen, you had a really great time going out to dinner with your team, blah blah blah, but you weren't smoking pot or anything. Just highlighting it for them because they don't care about statistics. They think we're lying.
They don't care, and and this was my son just now when I was talking to him before. It's like they don't think about the future. They're thinking about immediately. They are just like, and they also think, why is it bad? I mean, cigarettes are, they're all from plants. That's, this is what kids think. And it's just, between those two things, it's just really hard to get them to understand as well. So your points are very good, Amy.
Yeah. Okay, we're at the 8:02 mark.
Okay.
Thank you
So
for everybody for logging in. Like we said, through the Mid-Fairfield Youth Cannabis Project, we will be sharing tonight's recording so you can share it with friends. You can watch it with your children. You can fast forward to parts that you found most interesting. And we'll also share resources in our 5 communities where people can go to seek help. So thank you so much. We hope you learned a lot. And thank you, Dr. Swift, for joining us and sharing all of your wealth of knowledge with us.
Thank you for having me.
Thank you.